The conference room is very tiny. So why don't we start in the conference room? And if you guys want to just go around and share your name and who you're with, well, then we'll hop over here to Zoom and do the same.
Martha Marfileño with Buffalo County Community Partners.
Alex Reason with Buffalo County Community Partners.
Tana Miller, Buffalo County Community Partners.
Ellery Butterfield, Buffalo County Community Partners.
Jessica Vickers, Live Counseling.
Hi, Jessica, in person, yay. All right, is that everybody at the conference room? I think Matt's there somewhere too, so. All right, and then we'll hop over here. Let's do Denise, Michelle, and Cheyenne.
Denise Sweeter, I might have to get out of my office and go see Jessica in person.
Michelle Tucon, also with Community Partners. Will not leave my office for the conference room, unfortunately, but glad to see you guys today.
Be a long walk.
Cheyenne Adams, Region 3 Behavioral Health Services.
Awesome. We'll do Krista, Emily, and Nicole.
Krista Fritzen, clinical psychologist, and with University of Nebraska Kearney Beacon and LOS team.
Emily Lehman, Unite Us. Nicole, you're on mute.
Thanks, Emily. Glad somebody's keeping track of me today. Nicole Hirsch, I work for HHS and I'm a CFS supervisor.
Awesome. And I'm Jamie. I'm with Families Care here in Kearney. So, all right. Looks like we need to review and approve the September steering committee minutes. Does someone have, I don't notice, Community Partners, do you guys have the minutes to review? I don't have them in front of me.
It's like Denise is frozen. Maybe everybody.
I was going to go find the agenda packet so you could see those, but they were in the packet. So if everybody got a chance to look at those and maybe just forward a motion to Jamie to approve.
All right. Did everyone have a chance to look over those? I briefly looked over them.
Matt is also pulling this
So I
up.
can't go back and forth.
Do you need a second to approve
I
them?
was to say, I'll motion to approve. I'm not sure my
Oh.
the internet's kind of in and out.
I'll second.
All right. So do we do the vote too? Is it like a whole, are we doing the whole? I don't remember what those rules are called, the rules of. So everybody okay to approve the minutes? All right. So we'll call those minutes approved. So we're coming together today. We just kind of want to make sure that we keep in mind and in focus the collaborative impact, that we've talked about throughout this process as we're going through some shifting. We're really wanting to base that collaborative impact on, results-based accountability and data and things like that, as well as our impact statements. So just want to make sure we keep that front and center as we meet for all of these steering committee meetings. And, everyone's familiar with the collective impact statement and the process that we've been through. We need to go through that. All right, we're going to call that good too then. So I think we're going to go over to the committee charter with Denise.
I come out to join the conference room as soon as the owl knows I'm here. There he comes. Okay. Yes, so Travis and I took some time to look over the, what this is called a committee charter. It is actually a part of the Buffalo County Community Partners Board of Directors bylaws, or the organization bylaws. So it starts off with, it says ad hoc committees, but that's actually a carryover from the previous pages of the board committees. And so we being the board and the organization, wants to document this committee charter as well as the collaborative, and thought that forwarding this information to all of you to take a look at. About the last page in the packet. Man, it's always down. One more page up. There you go. So we wanted to have some time to talk through that with all of you today as well. Every time I look at it, I have a few more little changes, but for the most part, I think the content is good. But I just wanted to take a minute, ask if you've had a chance to look over that committee charter. It is an addendum to the bylaws of the organization. So we just want to make sure and capture the work of the collaborative and the work of the steering committee. So any thoughts from those who had a chance to look that over? And I would accept any changes or suggestions you might have at this time. While you're formulating and processing that on your end, I will share that most of the content, especially the piece that Matt is showing right now, is all the product of your brainstorming when we first started coming together as a steering committee, and we began asking what is our function and what do we want to do. So I've captured a lot of that. I just want to make sure it still rings true and is the work that you want to do. So you have said that you want to, like, number one, you want to ensure that we have a draft of impact statements or introduce those to the collaborative for consideration. And then on number two, you want to focus on aligning prevention programs, whereas community partners, again, this is coming from community partners perspective, where we lift up our prevention work into the collaborative, and making sure we're creating SMART goals. So again, you're working on that right now. Number three, to ensure the collaborative and the work groups have trained volunteers to lead the work, identifying missing sectors and creating space for new partners to join. And four, discern what is working and focused on the end result or the impact of the collaborative work. And the last one is to work in partnership with the board in designing a decision-making matrix to prioritize shared agendas that lead the work. I did add an A and B in there. I was willing to kind of let those go since this is a document that will live for some time. But I also thought there was some good content in there about how we'll make decisions as a steering committee and a board. So I am willing to leave that in, but just open for your consideration as well. Is there anything missing in what you're reading so far? This could also be used as a job description for future lead steering committee members.
I like all of this. I think it encompasses kind of what we're looking for as a collaborative and a steering committee and how we want people to contribute. So I think that this is great.
Kathy Gifford was in my office yesterday and we decided to strike everything below work groups. We felt like putting the impact statements and the prevention strategies in this document may not be appropriate since it's a timeless document. So I did strike all the rest of that for her recommendation, because prevention strategies may change between now and 5, 10, 15 years from now.
Yeah,
Do you want more? Oh, go ahead.
I was just gonna say, I think we all would probably agree with that.
Do you want more time with it, or does this look good and you want to forward it to the board to approve and place as an addendum in the packet?
let's see what the board thinks of it for approval and then add it to the packet.
Nicole, are you my only board member on this call? Would you be willing to forward that to the November board meeting on behalf of this group?
Do you just want me to email that or do you want me to?
I will put it in
Got
the November board packet if you just present it to the board and ask for their approval.
Yeah, I'm just making sure I'm gonna be at that meeting before I commit. Yes, I don't have a conflict that day. Sorry, my schedule has just been crazy like until the end of the year, so I always have to look, but yes, I will be there. I don't have.
Yeah, it's like we all realize it's the end of the year and we're all in a panic mode, aren't we?
Right?
Thank you for doing that. I don't know if you want to, you guys are kind of casual with your Robert's Rule of Order, so I hear consensus. We can move it forward unless I hear anything else, and I'll pause to see. That's uncomfortable enough. We'll move forward with this to the board then. Thank you all.
All right, everybody, we're gonna chat a little bit about kind of where we've been up to this point. So we have our impact statements, and at our last meeting, we talked a lot about our quantitative, qualitative, and like change in behavior, what this looks like for the collaborative moving forward. So we also drafted some goals, and then we put together some new goals to approach the steering committee with. So you can see on the left side our previous goals, and we added a little bit of information to goal number 1. So what we've kind of added in there is the gather prevention strategies in a tool listing the programs of the collaborative partners and intended age range served. Members of the collaborative will report out a number of families impacted and identified gaps or issues in prevention system, and consider adding depth to the partner data by tracking referrals potentially through Unite Us. So that's a lot of information in there, but what we're getting at is just having the data to support the work that's actually happening in the community. And so for goal number 2, we shortened that up quite a bit, and we have access to the Buffalo County Youth Crime Commission data, crisis response data, and premature deaths information. And so we'd like to use that information to start tracking some of these goals. And in addition, we think that organizations are already tracking some of the data that maybe the Crime Commission will miss. So receiving that data from organizations down the road just to track who they've worked with, what the outcomes are, have there been any interventions, how proactive or reactive have we been? Then goal number 3 is host 1 or 2 focus groups of youth and parents with lived experience, success stories, people that have received services and not re-entered the system. And we're going to share that with funders, community partners, and a broader community by the end of next year. So we want to see, are children and families better off with the interventions and the resources that we as organizations can provide to them? Jamie or Denise, do you have anything to add to that?
No, you're doing great.
There's also been some discussion about what age group we're going to capture, and I'm not sure that we settled on like a prenatal to 11 or 10 to 18. There were lots of discussions about this. We know that we'll obviously cap the work group at measuring up to 18, but we want to make sure they have access to preventative programs, services, training, and other resources by engaging with the Buffalo County Wellbeing Collaborative members and documenting current funded prevention strategies. And again, all of this by the end of the year. So we want to know how much we're doing, and as well, we want to know how well we do it with that data tracking. So I think that's all I have. Jamie? did I miss anything with that share out?
No, I think you did a great job. Thank you.
The only thing I want to make sure we spend a little bit of time on is entering the system, because that has been the primary conversation on that goal too. So what we heard at the end of the last meeting was sorry, I have a frog in my throat today. Decreasing the number of youth, adolescents, and children experiencing adverse outcomes versus the use of systems. So that goal 2 has that tweak to it, and then we also have that data in front of us that we can spend some time talking about. So first, I'm just going to ask if you like the way goal 2 is worded, or if you have any other recommendations, and then maybe we could kind of dig into that data. I do kind of want to take experiences and move it after adverse, because it sounds like children are adverse. So I kind of want to change that a little bit.
Yes, I like the way you worded it when you said it the last time, Denise. That was much more likable.
So decrease the number of adverse experiences for children, adolescents, and youth that are preventable. And I think that opens up a lot more for Jessica here. We're not talking about systems that we're preventing. We're talking about how we. You are not difficult at all, girl. You are a beautiful voice, and we want to hear it all the time.
I think that's my favorite part of the way this is worded now, is that it does mean that we're not, we're encouraging those preventable services, but we don't want those adverse effects. So I love the way this is rewritten. Thanks for that.
Okay, I'm hearing support. So I'm going to move into data. What data do we need to have our eyes on? Matt's already pulled crime commission data, which is on the next sheet. I believe, I'm sorry, I can't remember which volunteer highly recommended the crisis response data, which I think we could have Jill come and present at your next steering committee, Jill being from Region 3, so that we could get our arms around what that crisis response data is for youth. But the data that Matt has pulled so far are like the major offenses. So I'll let you just kind of look through major offenses. The minor offenses are truancy. So I think if our diversion partners were here, they would like to see that. The non-offenses, I would love to hear from Nicole. It's neglect and dependent. Are our eyes on the right outcomes there, or the right lens there? And then I really don't know what the unknown, but there's very few of them. So I'm assuming they're just things that we don't have categories for. I will stop there and let you open the conversation for you guys to kind of think through, is this the right lens or the right data to be looking at?
I think it's a piece.
Okay. So Jessica's saying, so if we say this piece is really important to the next piece, and that next piece being the crisis response data, which the last time I looked at that, it was how many calls are in Buffalo County for youth. And I'm not sure if anybody else has seen that data recently that could give a little bit more color to it.
Well, and I think the other piece is like, well, another piece that I don't see here is homelessness. I don't know where we would gather that data, and that would probably be 0 to 18. That might be an important piece. And then I wonder, we had kind of talked about this and we might have already settled this, I can't remember, but like hospitalizations for like mental health hospitalizations and the recidivism in that.
Yeah, I'm wondering if the schools would like to see truancy a part of it. The attendance. Is that
More
on
than
there?
this piece here.
Is that, oh, okay, it's on that, sorry. But that would be truancy that's reported through the crime commission,
Yes.
not from the school system.
That's also I mean, on the abuse neglect side of things, that number seems low to me, but I'm just wondering how that gets reported.
Well, if this is the
Or the-
data I'm thinking of, because I've had programs where I've had to enter data into the JCMS for the crime commission. And like, when I'm entering data, some of the stuff like you're limited to your program to the type of data you put in. So like, from a therapy standpoint, we wouldn't enter anything on truancy or neglect. Or like that's not the information they're capturing from us. Does that make sense?
I'm guessing since it's coming from the Nebraska Crime Commission, that these are where law enforcement's being called in. That is a total assumption that this is coming direct from law enforcement reports.
I
just
wonder,
say that, because when it said Nebraska, like, that's who I, like, like Doug Kramer, our 3-year plan and the programs that recruit. Tana's Tana would be familiar with.
She ran away. I don't know.
The
That's
data
some
that-
other priority.
It can be a nightmare to enter. That's what we're entering data into, it's all for the Nebraska Crime Commission.
Okay, so that's a Doug question, so we can ask that, maybe at the next meeting, if that's where you guys want to take this next.
So I mean, so then that would include diversion and probation. That's where all this data is. And then those supplemental funds the counties get to develop programs, our data is in this too. It's the thing it's good information, but what I was saying, so like if one kid is in like one of the, we provide on-site counseling services in another county, so our data is specific to counseling. It does not mean their information in diversion or anything else where some of this other data is necessarily captured. We only enter what we're told to enter.
Doing a quick look, it looks like these numbers are from like the court. So like things that
Okay.
actually get,
Adjudicated.
I hate to say it, but you know, in the
They're
system.
adjudicated, not pre-adjudicated.
so I wonder if there isn't maybe a more local source to find this information, or, you know, I know a lot of the agencies a lot of our agencies have data hounds. I wonder if we can't maybe reach out to find some more complete, because these looked really low to me too, just given our caseload numbers, you know what I mean?
Right.
All right, so I've got some really good notes, for you to get to the next level of this conversation. You would like to see what data is available for homelessness, and I know there's a lot of challenges with that because we've been in that space a couple of times and it's hard because it's not reported well, but we're going to take a stab at it. Hospitalizations, that's something else Matt and I can kind of talk about and include our hospital partners. That would be a good question for Travis and CHI. Jill bringing us some crisis response data. Premature death should be a part of the census data that we can pull. I want to just ask this question because we can go on a data find and we can talk about all the specific data, but I do want to come back to the SMART goal. What do you need and what are you thinking? How we decrease this number and what is the number representing? And by bringing all this data, will you get to that question, that answer, or can we bring a simple measurement tool to the table? That was a long question.
No, but that was a very good question. And I would say offhand, I mean, that's a lot of data and I don't know how, especially with the different places that it's collected, how we work to use that as our impact or measurable. Does that make sense?
Yep. Making total sense to me. Okay. Others on Zoom, thoughts? We want to create a SMART goal. What would you like your staff team to do to help you get to a measurable SMART goal?
I apologize. I was going to say something sooner, but my dog is barking at me. The joys of working at home still. I guess for me, can we create a SMART goal without having the data first?
That's it, because it's hard for me to judge what's attainable without having a baseline, I guess, and kind of having numbers to kind of support and drive that.
Okay, so I wanted to hear that to make sure that our data mining is a productive use of our time. So for your next meeting, we can bring forward what's available in the juvenile justice plan. Since we draft that, I don't know how much we have in data collected to show those outcomes, but I think that's a good Doug Kramer question. Because somewhere, all the work that Jessica's putting into that system called whatever.
Yeah, you can go back. You can, because I had to do that not that long ago. I had to go back about 5 years.
Yeah, we can go in and ask for that information from the
fun.
crime commission, but I'm not sure what that looks like, but we'll undertake that because it needs to be done anyway, right? And then, let's see, I lost my train of thought. Homelessness, hospitalizations, and Jill and premature deaths. We'll just start bringing what we can pull together to the next meeting. Suggestions on anything you all can be bringing to the meeting, or open doors for us, or other things you think we should consider?
So let's see. So if we're looking at numbers of hospitalizations and thinking of SMART goals and outcomes, what is the outcome? Because we've talked about that, does decreased hospitalizations really show what we're trying to do? Is it decreased re-entry? Is it decreased, or is it our families getting the resources they need upon discharge?
That would be my suggestion, is that reentry, like a second time in. This is very much my lens of my work. So I don't think this encompasses the whole goal, but I guess just a piece of it from my vantage point is, had some experience with kids in that unit. There wasn't information for me coming out of it. And had I not had the training and the support that I have through my job, I don't know that I would have known how to do that. So for me, like, has those decreased over the last couple of years? Has that improved? That would give me some idea of what might be needed for families out of that situation, so that there isn't those repeated hospitalizations.
And so when I'm thinking about rehospitalizations, I'm almost thinking about the reasons why for rehospitalization. So was it a lack of resources or lack of supports? Are we in the hospital for new reasons? And it's looked at re-entry. Does that kind of make sense? So, like, again, not looking at re-entry as a negative all the time. I mean, we want to make sure they're not coming back for the same reasons, because they're not getting the resources and supports that they need. But some people come back and it's a good thing.
For sure. Well, and that's, I guess I was just going to say, to take that a step back, like, do they have access to counseling? Are they accessing those preventative services too? That it's all where you want to jump in on it, I suppose.
Then with even like homelessness, the reasons for homelessness to me are important because is it a lack of access? Is it a lack of resources? Is it a lack of, have people been kicked out of the shelters and can't come back?
I do want to maybe pause and just ask
Maybe you can just
Nicole. No, I don't think so, because you're asking the questions and I just want to pause for a minute, ask Nicole and Emily to process a little bit of steering committee responsibilities and then what's moving into the collaborative work group. Because the collaborative work group is about to nail what their kind of their SMART goal or what their specific pieces are, and they are beginning to ask, how do we know those early childhood programs are decreasing children from entering systems like what we're talking about? So I do think the questions like Jessica was just asking can be the center of their conversations. So then I asked myself, what does a steering committee need to do to support that so that they have a good conversation? So I'm going to just pause there, ask that question of Nicole and Emily. And what is the role of steering committee to support that conversation at the collaborative level when it comes to data and this SMART goal?
I think we need to figure out what's already being tracked, so we're not duplicating that between organizations. Like we thought maybe ESU was tracking some data that could be used to look at youth that had services in place early on versus those youth entering or having like adverse conditions later in life. So I think we want to see what data is already out there so we can decide kind of what we need. So
I think that would be helpful. Yeah, if the steering committee could help get us that data.
Thank you.
At least for now, I think that's probably our biggest thing, because that's going to help us kind of drill down on our group. Where
And I think,
sorry,
I
go
think
ahead.
we do need a baseline. We need to know where we're starting, at least with part of this population that our work group serves. Otherwise, I'm not sure how we move the work forward if we don't know where we've been. And then a way to measure the data moving forward, whatever that looks like for everybody. And probably preferably like one way to measure data. I don't know that that's even possible, but.
I just think SMART goals SMART goals typically have to have a baseline. That's what I'm starting with. Just what they're saying.
Yeah. Okay, so I'm going to try to repeat what I hear as our next steps for this work. The community partners staff is going to bring forward data around crime commission, crisis response, premature deaths, homelessness, hospitalizations. Ask a few questions about reentry. How do we track reentry of those systems? Is it being tracked? I also heard a mention of maybe ESU data available as well. Bring that to you guys at your next meeting or as much as we can get in the next 30 days so you can be looking at it. And our primary goal at the steering committee level is to set that baseline, which will help us measure goal 2. And we like goal 2.
Well, and just to toss in, Kathy put in the chat, please keep in mind the steering committee is to support the work group rather than do the work of the work group. I think she just heard Denise ask that question, and that's a great reminder. I'm kind of a worker bee, so that's kind of the direction I go when I hear these things. So it's a good reminder.
Yeah, we're here to produce a structure for them to work within and to support them to some degree so they're not doing a lot of this legwork that we're talking about. Okay. I think I am fairly muddled in a positive way. How's that for an answer? Would you all agree that you're at that space? And it's the best we can do at this point in time. Okay. Good job. Oh my gosh. Okay, just stop for a minute and just pause and reflect how long we've been talking about systems, and you've come a long way today, gang. Good job. I don't think I had anybody assigned to this next piece, but I wanted to bring forward some conversations that we're hearing about on a staff, from a staff perspective. I want you to be considering as a steering committee, your role and what other things are happening in the community that are coming to you to ask how community partners gets involved in this work. Or if it's work community partners is moving forward because we've identified a gap. So it's kind of that lens that I'm hoping you guys can be looking at this. So this is kind of like all other work that we can be doing outside of these SMART goals that you just helped the work group do. Was that helpful? Okay. I don't know, do we have any violence prevention partners on the call that attended that meeting? With Matt Lohmeyer and CHI Health. Not Jessica? Is Matt our only champion around the table as at that meeting? Ooh. Spotlight's on you, man.
Well, I had the presentation I could have shared today, but, you know, we'll leave that for another day. But basically CHI is working on putting together, you know, I guess it's a violence prevention. They're kind of looking at it at a broad lens, but at first my understanding was it was more towards geared human trafficking, but it's kind of evolved into just being more violence prevention. They've only had one meeting so far, and it was just kind of to go over that presentation about what it is they're doing and trying to do. I believe they have another meeting this coming Monday at the 24th, from 11 to 12:30 or 11:30 to 1. So if you're interested in what that conversation might look like, reach out and let me know. I can forward that information on to you. I believe Matt is looking at or wanting to see kind of almost like what we're doing here, but more towards that violence prevention of what data is out there. So I know for like myself, I shared some of the high school, the YRBS survey that we do. They have some questions in there about if students that have been forced to do anything sexual that they did not want to do, and, you know, questions like that, that I was going to share with him. And I believe there were some of the other partners that I remember seeing were Safe Center, and I'm drawing a blank on the other ones I was going to mention, but that's kind of where they're wanting to go, is focusing on violence prevention and or human trafficking.
Abby, do you have anything else you want to add to that?
I really don't. I've not been able to attend quite yet, so.
I am having lunch today with Nikki Gosman at the Safe Center and Jamie Vetter at FAN to talk about the leadership of this work. I do think it's important for the steering committee to be aware of this and know that they're needing some supports. We just don't know for sure what those supports are going to look like.
Mhm.
And from a Buffalo County Community Partners perspective, I want to make sure that we have the time to give it. And we also, as a steering committee, need to think about what work they're doing and how it aligns to the overall impact statements that you guys have, that the community's created. And Nikki and Jamie see that, but that's kind of one of the things I'm going to be doing as well.
Okay.
Any questions or thoughts from the team? any next steps you want to get reported? We'll keep this on the agenda and keep bringing information to you. It's my understanding that they have a national CHI grant for planning for 1 year and then potential for a 3-year project grant after that. But they do need to do the planning part first.
Yep. Yes, that's my understanding as well. So this last Saturday, part kind of just a kickoff to that, we did have the A21 Freedom Walk this last Saturday, so it was a okay turnout. So hopefully that's something we'll be able to do going forward as well.
Thank you, Abby.
Mhm.
Nebraska Children and Families, I'm moving on to bullet point 2. Brought Jamie and I together, Jamie Better with FAN, together with a few other statewide abuse and neglect associations. And it hit me that we don't have Jamie at the table, or a lot of our teams outside of like Nicole's group that's working in the area of abuse and neglect. What I heard from Jamie was alarming. They are so overworked, overwhelmed. Children re-entering into systems of abuse and neglect. I just wanted you all to be aware that I would say, after listening to her, they're at a crisis level, because all they can do right now is deal with the emergency. I shouldn't say deal with the emergency, help the child that's in crisis, and the family that's in crisis in front of them. I just wanted to bring that to your attention. I do think they're missing in this piece of work that we're doing because they're in crisis. We are doing like a self-care kit to all their staff, and I think that will go out here in the next couple of weeks. So they all should get a little packet from us with some coffee gift cards and just nice little thinking of you type basket for all their staff. So we thought we would start there. I'm going to talk to Jamie a little bit more today about her vision for prevention. When I asked her that question a month ago, she looked at me like, prevention what? We're in crisis. So I don't know if there's any other thoughts, next steps. Just wanted to really point out that missing partner at the table and the level of stress I see on our community. Any other thoughts, comments? Agree with that. There's agreement. I think for me, when a partner as significant of that is missing at the table, I don't see that urgency, because usually people who are at our table are people who are reaching outside of the organization to get involved in the community. So I just wanted to bring it forward so people were all thinking about this piece. I don't have any answers, just want to inform you that there's a significant missing partners in this space.
Do we partner at all with the Royal Family Kids initiatives here in Kearney?
A little bit. I mean, they have their program, I would say. I don't know how referrals to that operate.
It usually goes through DHHS for the camp. I think some of the foster care organizations help with that too.
Yep. Yeah, Jessica's right. It either comes from our caseworker filling that out, or a lot of times foster parents or our foster care agencies is typically how kids get set up for camp. And I know Royal Family does like a huge promotion, you know, so everybody's aware when it's going on and stuff like that. And we get lots of emails, and they come to like our building meetings and things like that and talk about camp, so our caseworkers really understand like what the camp's purpose is and how beneficial it is for kids to attend. So they do a good job in that sense.
I guess my follow-up question was, I know that they have an ongoing thing for middle school and teenagers. That when I was involved in Royal Family Kids, they had this going, but it's throughout the year. I don't know if I've heard from Royal Family Kids people about that program. I know it happens. I know it's going on. I just don't know if we're hearing from
I
them.
think it's still Sandy Cook Fong, isn't it? That runs that out of UNK.
Okay.
Mhm. So next steps. Anything else that you want us to keep bringing forward to you in relationship to this conversation?
Just that it's growing. And it's, I think even Nicole probably speak, our providers that are doing this, that work with families that are experiencing abuse, it's burning our mental health providers out.
Yeah,
Um,
I would
It's-
absolutely mimic that.
It is, I try to, even at our office, I monitor caseloads, because it's to the point where I have to say, you can't take any more cases, any more clients of these presenting concerns, because you're getting burned out. Which then limits our capacity to serve. But if we completely burn out the providers, there will be nobody to do
Yeah,
this work.
I think it's a vicious cycle, of course. As Denise mentioned, Jamie says that they're in crisis and all these families coming back into care and things like that. And we have a struggle, so we may have certain preferences on what therapists we use and things like that, because we want kids to see good quality therapists, right? And so we have lots of discussion of matching that kid with a therapist that can meet that kid's unique needs. But when you're limited and only have a handful that can serve that child, then we're burning them out on that level. But also just, I think in general, kind of what Jessica was talking about, is that they have got to be overwhelmed. And I know I have several kids right now that are just on wait lists just for outpatient therapy. And so it doesn't help the whole reoccurrence.
It's not even just abuse and neglect. When you were bringing up the concern with violence in the community, I mean, there's a growing violent culture in our youth.
Yeah.
And it is, so we have abuse and neglect, we have suicide, increasing suicide, we have increasing like kids wanting to like have safety concerns of them not even being safe towards others.
Yep.
It's
And-
across the board.
And I don't know what you guys see, Jessica, but we seem to see kids at a younger age having them more violent behaviors than what we had seen historically. I mean, we've got sometimes 6-7-year-olds that are just destroying.
And I've had those conversations with schools, the teacher, and then it spills over to the teachers. The teachers are burned out because they don't know how to manage these kids with special needs, and then they're relying on help from us providers. And we're getting more and more limited, and it's a very vicious cycle. And I don't know how a sense, I would say our home, those systems, we're all in a sense, probably not to the degree that Jamie and them are over there, but we're all kind of in a crisis mode, just essentially trying to take care of what we can. Which then limits other people who are needing service. I mean,
I don't know if I have the right framework when I'm thinking about the work that the work group is doing, so the collaborative work group. In my mind, the framework that I keep looking at is that it's around behavioral health supports to change some of those behaviors from ever occurring or reoccurring. When I look at abuse and neglect, I don't hear those conversations around that work group table. That concerns me. And I think because they're not at that table. So I'm bringing this up because I'm also wondering if Matt and Abby can help lift, and Jamie's gonna be there because Jamie's on that CHI team. I think this conversation belongs with that violence prevention work. I don't think us in that work group can tackle all of these pieces. But I do think we need to recognize that it's a huge element of the community that needs to be communicated as a gap for others to understand what's happening. And I don't know if I'm looking at this in the right framework of the work group being more around behaviors and
our work is more towards how to help families decrease even seeing us.
Yes.
Their work is more like they need support in their workforce. I would agree with that. I think I just wanted to bring that awareness. That there's like this whole, it's all connected at this point, and it's not getting better by any means.
So kind of why I was asking about like the Royal Family kids. So we've got these kids on wait lists. Are they just sitting on wait lists? Are we being creative? Like, can we be creative about getting them to, I understand that we don't have LMHPs, but I mean, like my grandma never got her LMHP. She's the best therapist I've ever met. She's an Indigenous woman. Do we have opportunities to just outreach to people in the community that are already connected with these kids? Are we?
I would
Are
tell
we
you, we
thinking
are
that
doing our
way?
best to fill any gaps that we can while kids are waiting for either counseling services, getting them connected to any supportive services, which are also sometimes have wait lists. I mean, Nicole, wouldn't you agree?
Yeah.
I mean, it's like,
I mean-
we try to think I mean, we're always thinking outside the box. I always appreciated Region 3 because they are big outside the box thinkers.
Right.
And so I just had another conversation with them of how we can think outside the box to increase access to services without relying solely on mental health providers. It's just not a real clear path on what to do.
Okay.
And I think a lot of times what I typically see, you know, when you have a family that is struggling, part of the concerns are their supports and the lack of them. And so sometimes, I know you mentioned your grandma, like, unfortunately, like, them are the type of supports that would be ideal for some of these families, but they just don't have them. But we do, as far as like the mental health side of things, we work with our MCOs on what other things we can put in place. We have some therapeutic services that are strictly contracted through the department, so we utilize them, but then sometimes it's like slapping a Band-Aid on it. It's not necessarily exactly what the family needs, but that's what we're kind of utilizing as kind of just like a wraparound. But it is definitely a struggle right now.
The work that we're focused, I think that's where this work is important, because sometimes we can offer all kinds of options. Nicole, you would agree with this. We offer all kinds of options, and families won't engage with those options.
Yeah, because
And I think that's why this work, what we're doing around the table is important, because that's what we're looking at is, okay, so is family engagement a piece of this puzzle as to why kids are re-entering services?
And then coming back to that collaborative to really, the questions you're asking, I would love to bring up
Yeah.
more at the collaborative level, if you're
also
okay with that.
Connected. It's just.
It is connected.
and I hope that didn't come across as like, it was
No,
not
it's valid.
accusatory. It's just,
It's very valid.
it's just a follow-up of an outsider not understanding everything that's happening.
And I will also tell you that your providers that work with kids probably do a lot more of that thinking outside the box and trying to fill in resources, where folks that aren't as used to working with kids aren't
what's
familiar with
going
all that case management work that's going to be involved in working with the youth.
That's what it was. Yeah,
So
thank you.
that makes sense.
Great conversation. I think some of those pieces that we were talking to, we back up into your first SMART goal. What are those services and where are the gaps in those services, which I think there's a lot of good conversations happening around that collaborative level. So thank you, Nicole, and thank you, Emily, because I know you've been in, all of you, but I know specifically both of you are thinking, how do we bring this back to the collaborative group to have that conversation? To kind of wrap up the next steps with violence prevention and the missing partners, I just wanted to make sure Abby and Matt have those pieces. If there's others that want to be invited to that Monday meeting, like for myself, I did not even know there's another meeting. So I think I'm out of the loop on when the meetings are. So if there's others that want to get that information, maybe let Abby or Matt know so that you can carry that information there as well.
Yeah.
I'm going to move into Carney Works. We are the recipients of $72,000 that is coming to Buffalo County Community Partners from Carney Works. It is expanding the community response model. So it's work that we're already currently doing. And I don't believe we'll really have much traction with this funding until next year, probably the first quarter of next year. The primary purpose behind this funding is to work with a few of our employers. I'm really looking for like a couple pilot projects with employers that help retain employees. So those employers are thinking about that employee who maybe is habitually tardy, unable to be at work because of childcare challenges or transportation challenges, or maybe hasn't communicated the challenges that they have to be able to pay rent every month. So we're going to be able to identify some employees within those workforces that we're going to see if that community response model can be piloted through the employers to retain staff. We hope they'll bring a greater understanding between the employer and the agencies within the community on how this work is integrated and can be integrated. Very similar to the things that we've already been talking about. You only know what you know when you need it, right? And so helping some of those employers access those supports for their employees and helping employees to talk a little bit about what those needs are, we're going to attempt to pilot. So those are the dollars that are coming, and we'll keep you in touch with that work. And I am going to hand it off to Martha to talk a little bit about the ARPA grant that she has been working with on the bilingual mental health first aid piece.
So we had reached out to a couple of faith communities, St. James Church, the E-Free Church here in Kearney, and First United Methodist Church, to see if they would be interested in working together to provide some training through faith volunteers that are bilingual, to be able to be trained to provide Spanish mental health first aid in their ministries. And the format that we were talking with them was that they could offer that as part of some type of a book club. So it's not just 2 days of training, but it's incorporated more over several weeks, including scripture. And they would be able to just be able to provide that in a book club format. So there was interest from those 3 faith communities. And next Wednesday, we'll be meeting more to discuss what that could look like. From each of their church ministries, they've had bilingual individuals that are interested in being trained in Spanish for the mental health first aid.
Yeah, we're kind of excited about this work. We hope we get some funding. We're going with the January application. We just didn't have everything in alignment for last Friday's application. So we're hoping there's some money left for us to apply the next round.
It's a 3-year.
3-year, $100,000 per year, I think.
I know, so it's.
Let's hope not. Yeah, Chris is not on the call to give us more advice.
I sent in 3 grants.
We'll see what comes back. Is this something you want to keep on your agenda? Emerging initiatives, programs, resources, because I think this is kind of that other bucket of work that you all want to be a part of. And this is the best way to do that.
Yes, and so one of the ARPA grants we wrote in for was to support Live Well continuing to expand the internship program, so we can increase capacity in our area. So that was one of our initiatives with the ARPA funds.
Yeah, Denise, I like this part of the agenda. That way we can continue to be informed, and then again, make sure we're not duplicating services or recognize if an area is not being addressed.
Is there anything else out there that we should keep on this list that I'm not aware of, or maybe I'm aware of and just haven't made the connection? You know, one thing I'm thinking of is Maha Eunice's. I did talk with her a little bit at movie night, and I do believe UNK should have approved or is close to approving their DEI policy, which I think just kind of keeping an eye maybe in that work of what's happening. Anything else you guys are thinking of?
I do know, kind of piggybacking off that, just, you know, seeing emails because I teach there too, but they're definitely offering a lot of educational opportunities for their employees to really understand DEI. And like, I know there's one this week or next week on implicit bias. So I do think that she's doing a wonderful job of exposing them to these concepts that they may not have been familiar with, but
Thank you, Abby. One of the things I did ask her is, and I think she sees this too, is how to then replicate that into the community or in other workplaces.
EID, emotional intelligence, or
Diversity, equity, and inclusion.
Okay.
We've dropped a B on there once in a while
Sorry.
for belonging. So it's
Trying
making
to-
sure people feel belong, that they belong. Thank you for asking that question. Anything else out there that you're hearing or seeing or want to bring forward? Okay, I will hand it to Emily and Nicole to talk a little bit about, we did share a little bit about what happened to the last work group, but I will hand it off to you guys.
So at the last work group, we talked a lot about kind of what I said earlier with that age range, who to target, is there data out there? How do we track some of this? So the group was pretty dedicated to including that prenatal. So we often refer to like birth to 5, birth to 8, but wanting to include that prenatal age group as well. And there was a lot of discussion at that meeting about what resources are currently out there for young parents for prenatal. And we bounced a lot of ideas around about, you know, people that have children, what they went through when they were new parents and how little education there is out there for parents when they have a baby and they're going home, and it's not how do you put a car seat in, it's let's just make sure you have a car seat and things like that. So talking about that education piece, as well as what group to target. We talked a lot about what resources are out there, how we can provide them. Are there gaps in services? How do we identify gaps in services? So it sounds like Sixpence is tracking success of the life of the child, and will they have and they'll have academic data at KPS. Head Start has proven successful, like great research. So I think we're going to try to tap in to some of that information. But we went through like in the community, kind of what's working and what's already in place. So we have an idea of kind of the direction we need to go and the way that we can support the work with current programs. But I think it's, do we have everybody at the table that we need at the table? Are there other organizations we need to add? If we're going to focus on this Nebraska Crime Commission data as part of kind of a subset of this group, do we have all the appropriate people at the table? Do we need to, pull in other organizations, Kearney YMCA, where they have some programs, the Bridge to Independence group out of HHS that serve kind of that disconnected youth population. So what does this look like as a bigger work group, and where do we need to tap our resources to make sure that we have all of the information that we need from all of the people that should be at the table with us? Nicole, is there anything you want to add? Oh, did Nicole drop off?
Another resource we have, especially around prenatal and postnatal depression. Livewell has one provider, Monica. She specializes in working with prenatal and postnatal depression. I have another provider who specializes in Grand Island, but since it's Buffalo County, we at least have one. I don't know how many other providers are specialized. Monica went through a training that was probably about a year ago to do that.
Okay.
Excellent. We'll capture those resources too for the minutes, so that we have those documented if we need to come back to it. I really found asking the question with this group had some profound thinking, not that I'm taking credit for this. That sounded bad, didn't it? But is anyone better off? And so we began asking early childhood, how do we know Head Start, Sixpence, all of those things listed and how much we do is truly preventing children from entering the crime commission data, right? And so I think that's gonna be a really, really good conversation for them to continue to flush out, and focusing on parents. I'm really, really excited to see what happens there, as well as I know Jamie jumped off at what is that lived experience piece come to the table with as well. Any comments or thoughts for Emily? Anything as a steering committee that you want Emily to carry back to the collaborative work group from today's meeting, or any other questions or thoughts? Any clarity in roles, clarity in data, clarity on SMART goals, anything you want them to hear from us? I will keep asking that question. I know we're still processing that, right? What does that engagement look like, and what's that relationship look like? So I'll keep asking that question every month. What does the Buffalo County Community Partners Board need to hear from today's conversation? Kathy, I will share with you that Nicole is prepared to present the charter back to the board at the November meeting. So that is one thing that is coming back to the board. Anything else, team, that you want to share with Kathy? Kathy, anything from the board perspective?
I don't think I have anything right now. Thank you. Appreciate all your work, everyone.
And I will keep asking this question as a part of your monthly agenda. Back to Emily and Abby. I don't know if there's anything else you want to cover to wrap up.
I don't think I have anything. Just for, I guess, transparency, I'll be presenting a little bit at next week's collaborative meeting about Unite Us and what we do, and how we can support that data piece to really drive outcomes and have that information about the work that's actually being done in the communities. So if anybody has any questions about Unite Us or data, or would like to set up a meeting with me to chat more about that, just let me know. Other than that, I don't have anything, I don't think.
Abby, do you have anything? Okay, what I
Really don't. I've been unfortunately very remove's not the word, distracted from this work. So I appreciate all that you all have continued to do to keep it going, and hopeful for the future.
We too are hopeful for you in CHI, Abby. We know you're going through a lot of challenging things that you probably never anticipated would be coming your way.
Yeah. Yes, healthcare is still in crisis as well, just as everyone else. So I just appreciate that you guys recognize that with all this work, that it's just a different times, isn't it?
That it is. Well, thank you for spending some of your valuable time with us today. So in wrapping up for today, kind of those next steps for the next meeting, what I hear is that we will forward the committee charter to the board for approval. We have landed on the SMART goals that we can get to at this point. Now we're ready to start building baselines. So in order to start building baselines, we're kind of focused on the SMART goal 2. Number 2. And that data that we can bring forward to the next meeting will help us establish that baseline. So those should be our next steps in our minutes as well. Keep our emerging initiatives on the calendar or on the agenda to keep updated with what else is happening. And then continue to ask what our role is with relationship to the collaborative and with relationship to the board. Did I miss anything for next steps? Internally, we're working diligently. We've always been working diligently, but even more focused on minute taking. So if you've heard me repeating next steps, those are the things we're really working hard in getting very clear next steps in your minutes, so they're easy to review and see. And help the steering committee leadership set your next agenda. Did I miss anything? Any questions? Additions to what you want to see next month? Okay, we are meeting November 17th. A shout out to Emily, I think on the collaborative side, the collaborative meeting in November will land the week of Thanksgiving. So I was considering moving it to the following week, so that's just something to keep in mind, Emily, as we're moving into the November timeframe for the collaborative.
Sounds good.
Okay, I don't have anything else. Thank you for your time, everyone, and good to see Jessica in person.
Yeah.
I thought the meeting was in person.
It can be in person. This is the first time I said, let's be in person or Zoom.
So, and then, but then
Thank
I
you,
also
guys.
had on the agenda, it said 10:30, and then my